Since last year, Moroto Regional Referral Hospital has registered 605 admissions of COVID-19. Out of these, they only registered 12 deaths and only 6 persons are currently being managed in the intensive care unit.
On a good note, we have the least mortality rate in the country of all the treatment centers. Okay? On a good and a bad note, the bad note is that we don't have any specialists to run the treatment unit.
Unlike other hospitals like in Kampala, Moroto has available oxygen cylinders, personal protective equipment for the staff, and the general attitude of the staff is good.
And our consumption is at the moment about 16 per day. So we are safe. At the moment, we are even supporting Soroti with the cylinder. Okay.
And maybe just how many cylinders do you have currently?
We have 146, because we had 103, then we got 30, 114, then we got 30. That's 144.
Parliamentary Committee on COVID-19 headed by Dr. Charles Ayume, currently in Moroto on an oversight visit, has commended Moroto for good management of COVID-19 situation in the district.
First and foremost, it's very evident that there is work being done in this facility, contrary to what the public outcry is there. There was a very good presentation by the director. We have come in, it's very visible. The ministry has delivered its beds. The oxygen plant is very functional. You had his presentation. They actually have excess. They are using about maybe 50% of what the plant is producing. So we're happy about that. And they were able to donate some cylinders to Moroto Regional Referral last week, which had about an excess of 50 patients. So we're very happy about that.
The situation has improved significantly. I see positivity in the health workers. They are not complaining. They seem to be self-motivated to do the work. That's not what I expected. So I'm a little surprised, but also happy that you can find people who are enjoying to do their work in this country at this time.
However, the hospital administration pointed out poor infrastructure and lack of housing for the staff as the biggest challenge frustrating health service delivery. This forces the staff to run away.
Honorable members, I just request you to walk around up to the staff quarters and see where the staffs are living. They are not living in the houses. They are living in the shelters. You know, a shelter is anything which has a roof. Just like a bird can also make a shelter. Anything which has a roof. You'll see the shelter and you'll sympathize with these people. They are the ones helping the government, promoting the agenda of the Minister of Health, the agenda of the ruling party. They need special attention. This hospital needs an affirmative action to come out of this danger.
We lack specialists in the hospital. And one of the ways which we can attract these specialists, besides pay, is that they're able to come and find ready accommodation. They do not have to come this far, start looking for places where to rent, and at exorbitant costs. The standard of living in Moroto is very high. So I think when we go back to Parliament, these are key issues we need to prioritize.
Philip Aguta, UBC News in Moroto.